So my name is Vanessa Noel. I'm a shoe designer. I have a bunch of different companies, a bunch of different hotels. So I had a heart attack when I was about 3 years ago, actually, to the day, almost, and it was an incredible thing to learn that I actually had had a heart attack. I had been to 3 different doctors, and none of these doctors over about a 3-month period had given me a stress test. And I'd gone in and told them exactly, I'm very descriptive, especially being a designer, and details what I was going through. And I came to learn afterwards that they were very classic heart attack symptoms. So I had a very localized pain, always in the same spot, and I'd feel tightening of the chest, which is difficult to diagnose when you've never had tightening of the chest yourself. My shoulders hurt. I'd been having shoulder pain for, a few months prior. And it would radiate, this pain when it would happen, would radiate up to my bottom jaw. And depending on how strong it was, how intense they got to my bottom jaw, or it'd even go to my upper jaw. And then I would just start deep breathing, and I had no idea why I was deep breathing, and it wasn't like I was out of breath. I figured I needed water. I figured it was from a neck injury. I figured these episodes, which I call them, were for all different reasons. When I suppose the blockage would push through, then I would just, all of a sudden you'd feel the release, and I would perspire a little bit. And I went back to work. So meanwhile, my office staff was getting quite concerned, and I had some really bad episodes. And they made me call a doctor, which I did. And I went in the next appointment and got an EKG, and it was normal. Had a sonogram, it was normal. Great. I went home, I was fine. They started up again. I decided maybe I should get a stress test. I called a different doctor, a homeopathic doctor I was going to. And I was seeing her, and about 4 days later, so I waited. And I asked her for the test, and she told me I didn't need a stress test, that I should go for a CTA scan. That'll show me everything, including lungs. So I did that. It's out of pocket. It wasn't covered under medical. And what I learned from that is a CTA scan tells you how much plaque you have in your arteries. It's not anything to do with even cholesterol in your arteries. So I was told that my arteries were perfectly clear, and I was completely okay, and my heart was fine. This continued, the symptoms, and me thinking I guess I needed to drink more water, until I had a really bad day of them, and very frightening even to myself. So I got in touch with another doctor whom was a spokeswoman for American Heart Disease for Women. And I thought maybe she would look at me differently and understand. So I went to see her, had an EKG, had a sonogram, everything was fine. On my return trip, which was my second appointment with her, I'd had a really bad morning. And the difference with this morning with my episodes is it never really went away. So I got to her office, and the EKG was finally going a little wonky and askew. And even then, she sent me out of the office, or was trying to tell me I needed my esophagus checked. She thought maybe my esophagus was spasming. And I had told her, it's not my esophagus, it's my heart, and I'm not leaving your office, and you have to find it. So she didn't know what to do, and she thought to give me another sonogram, of which she did. And under the sonogram, apparently my heart wall stopped moving. I'd had a heart attack, which I have a film of my heart attack, which I still think it's kind of cool to have a film of your heart attack. But they cleared the cath lab on the nearest hospital, which was Lenox Hill, and I was rushed up there very, very quickly. And I was really lucky because my artery apparently was 99% blocked, and I got a stent. And I'm here today to be able to tell the story, to reach out, to help other people, and other women in particularly, to really protect themselves, to learn about their heart, and to focus on what's wrong with them, and to help doctors help them. If I had just left the doctor's office, I wouldn't be here today.